My name is Kyndal Gallion, and this is my audience. Okay, I did my essay on types of cancers. Many people in the world today are diagnosed with a type of brain or body cancer. Few of the people that are diagnosed are uncertain of what cancer is and what it does to them until the doctor tells them. There are primary and secondary types of cancer. A primary cancer only starts and forms in the brain. These include astrocytoma, lymphoma, glioblastoma multiforme, and meningioma. Secondary cancers are ones that are in the body and not in the brain. These include melanoma, breast cancer, lung cancer, and colorectal cancer. There are also types of cancers that only children get and teenagers, which include leukemia, brain tumors, osteosarcoma, and Wilms tumor. These types of cancers can be very harmful, or they can be fixed by some type of radiation. The first type of cancer is primary. One of these primary cancers is astrocytoma. It is one of the most common cancers that occur in middle-aged men, but can also be in all ages. According to the AANS, astrocytomas develop from star-shaped glials called astrocytes, part of the supportive tissue of the brain. When the astrocytomas affect the children, it is located at the base of the brain. This brain cancer is classified into three types: low-grade, anaplastic, and glioblastomas. In children, the type is low-grade, and in adults, it's high-grade. The symptoms that can be produced are persistent headaches, vomiting, loss of appetite, and many more. The treatment that can be chosen from is surgery, radiation, radiosurgery, and chemotherapy. Another cancer is lymphoma, which begins in the immune cells called lymphocytes. According to the medical news today, lymphoma occurs when lymphocytes are in a state of uncontrolled cell growth and multiplication. There are two types of lymphocytes, which are B and T cells. Lymphoma occurs when the T and B cells start to grow and multiply uncontrollably. The lymph nodes eventually start growing more and more, which turns into a mass of cells called a tumor. The symptoms of lymphoma is painless lumps in neck, weight loss, fever, and itchiness all over the body. The treatments are chemotherapy and radiotherapy. The most common and deadliest brain cancer is glioblastoma multiforme. The only grade form from this cancer is grade 4, which is the worst. It actually forms from the star-shaped glial cells from the astrocytes, just like astrocytoma. It is most commonly found in older men and can be found in women, but not likely. The only type of treatment for this cancer is to have surgery, but the doctors will most likely not get all the cancer out. After surgery, they will put you on radiation therapy or chemotherapy. According to National Brain Tumor Society, if inoperable, then radiation and chemotherapy can be administered. This cancer is the most dangerous out of all of them. The last primary brain cancer is meningioma. This cancer is formed in the meninges, which is the tissue that covers the spinal cord and brain. As the cancer starts to grow more, it starts compressing on the brain tissue. When the cancer starts compressing on the brain, it starts affecting the facial features, and it can change the visible features on a face. There are three grades to this cancer, which are called benign, atypical, and malignant. The symptoms that are associated with this cancer is seizures, headaches, nausea, and vision changes. The only treatment is surgery and then radiation therapy after that. Primary cancers are pretty dangerous and can get out of hand if not treated. The second type of cancers are secondary, which are not in the brain. One of the secondary cancers is melanoma. This is the most dangerous skin cancer you can get. Melanoma occurs when the unrepaired DNA damage triggers mutations that will cause the cancerous cells to grow and become malignant. If the skin starts to turn brown or black, you need to go see the doctor immediately. The only treatment is to get the cancer cut off by surgery. Another cancer is breast cancer, which is always found in women. According to the medical news today, breast cancer usually starts off in the inner lining of milk ducts or the lobules that supply them with milk. The symptoms of brain cancer is a lump in your breast, a pain in the armpits or the breast, or a swelling lump in the armpit. The main treatments for breast cancer is surgery, radiation therapy, hormone therapy, and a couple more. Another cancer is lung cancer. It occurs when the uncontrolled growth of abnormal cells grows in the lungs. As they keep growing, the abnormal cells can eventually turn into tumors and mess up the function of the lungs. The symptoms of lung cancer are persistent coughing, pain in the chest, shortness of breath, and your voice starts to change or become hoarse. The treatment is chemotherapy and radiation therapy. The last secondary cancer is colorectal cancer. This cancer affects the colon and the rectum. According to American Cancer Society, colorectal cancer starts as a polyp, a growth that starts in the inner lining of the colon and rectum and grows toward the center. The symptoms are pain in the belly, weight loss, and change in your bowel movements. This treatment is surgery, and radiation chemotherapy. Secondary cancers are not as harmful as primary, but they can be little dangerous if they are not treated. Cancer in children can be very dangerous, or they cannot be harmful at all. Some of the cancers that children can get are leukemia, brain tumors, osteosarcoma, and Wilms tumor. Leukemia starts to occur in the blood cells, which is bone marrow. The symptoms of leukemia are fever, night sweats, headaches, and bleeding easily. The only treatment for this cancer is like any other cancer, which is radiation therapy and chemotherapy. They figure out what kind of treatment to use by examining the spleen, or they test your complete blood count to see if it's abnormal. The next cancer is brain tumors, which is common in all ages, but a lot of them are more common in children. Brain tumors are big masses of abnormal cells that occur in the brain. The symptoms of tumors are severe headaches, nausea, vision problems, and difficulty with balance. The treatment depends on what size the tumor is and where it is located in the brain. First, if the brain tumor is where they can get it, then they will have surgery. The next steps are radiation, then targeted drug therapy, and then rehab to improve on anything that happened during the surgery. Another cancer in children is osteosarcoma. According to the U.S. Library of Medicine, osteosarcoma is cancerous, bone tumor that develops in teenagers when they start to grow too rapidly. The cancer starts to occur when they become teenagers and hit their growth spurt. The symptoms associated with osteosarcoma are bone fractures, bone pain, and limitation of movement. They do biopsies, blood tests, CT scans, and MRI scans to choose its treatment. The last cancer is Wilms tumors. The cancer occurs in the kidneys and is very rare. The only kind of symptoms that are with Wilms tumors is fever, blood in the urine, abdominal pain. They test to try to diagnose this cancer with blood tests. Children with these types of cancers can be very dangerous, especially leukemia. Telling a person what the signs and symptoms of a cancer could help them catch it early and be able to go to the doctor. This is my visual. It is the number of cancers deaths in 2013.